In this video, I'd just like to introduce you to a really simple technique that we use in cognitive behavioral therapy, which is one of the most effective forms of treatment for depression and anxiety. One really simple technique that we use to help you sort of react less strongly to situations. Oftentimes when you have anxiety or depression and a variety of other issues, instead of reacting to the fact of a situation, you react to the way that you feel about a situation. There's a thing called mental filtering that we often do, where we look at a situation and we pull out all the negative pieces of it, and we use those as the facts of the matter, and we just use that to inform our opinion about the situation. So for instance, if you walk into a room and nobody says hi to you, you might pick out all of the negative pieces of that. You say, okay, well, nobody said hi to me, so that must mean that they don't care about me. That must mean that they don't want me to be there. I noticed that, people are busy doing other things, so obviously they care less about me than what they're doing, and blah, 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 blah. And you pull out all the negative aspects of that. Now, often what that does is it sort of reinforces the way that we already feel about ourselves. So we have this sort of internal picture of who we are and what we represent and the way that we feel like we should be treated. And we find the evidence out in the world that supports that, even if there's more evidence than that out there. So, when you think about it, our assumptions about a situation or our feelings about a situation, often our thoughts about a situation, they're not necessarily the end all be all. And I think it's really important for you to try to adopt a more scientific approach. Like in the scientific method, what you would say is that you have a hypothesis about something. A hypothesis means a guess about something that you think might be true. So for instance, when I did my dissertation research on internet therapy, my hypothesis was that a certain type of person would be more inclined to do internet therapy than face-to-face therapy. That was my hypothesis, a guess, a hunch. I didn't know that was going to be true for sure, but that was the guess that I had going into it. So in the approach that I'm talking about here, it's very helpful for you to think about your initial interpretations of something, your gut reaction to something, and your assumptions as hypotheses rather than the fact of the matter. And so the exercise that you can do is to sort of evaluate that hypothesis, to evaluate that guess that you have and see whether it holds up or not. Because again, when you're in the grips of depression or in the grips of anxiety, you're going to tend to use that mental filtering. You're going to tend to pull out all the negative aspects or the aspects that support the hypothesis that you have about yourself, rather than seeing the whole field of what's out there. So the exercise itself is very simple. It's a 2-column exercise. So basically, you just draw a line like this down a sheet of paper. And at the top, you want to write what your assumption is. So for instance, one that happens to me all the time is that I don't hear from my wife for a little bit when she's out with the babies. And I think that they got in a car accident, right? So my hypothesis is that they were in a car accident. So what you would do is you would write at the top, here it says, family in a car wreck. So that was my hypothesis about the situation. I have a feeling that they were hurt because, my wife's been in a car accident near the house before, and ever since then I worry about that. So that's my hypothesis about it. And then what you do is you separate both sides of the paper into for and against. So one column is evidence that supports that hypothesis. One column is evidence that goes against that hypothesis. And so you really got to challenge yourself here. You got to say, okay, I'm going to be more scientific. And for me, I'm all about being realistic, not optimistic. Optimism has its place, but a lot of times it kind of gets you in trouble. If you're like rosy and optimistic and think everything's going to be fine and look at the positive about everything, you might miss out on important aspects of it. But at the same time, you don't want to be overly negative because that's committing the same sort of logical fallacy. You're just looking at one side of things. So with this is kind of forcing you to sort of put your brain on trial and say, okay, in the case of family being in a car wreck, there's evidence for and there's evidence against it. So let's evaluate that and try to look more objectively at the situation. And if you think about it, this is a lot of what goes on in therapy. You might have another person on the other side of the room, your therapist, asking you questions to kind of elicit some of these ideas that, yes, some things do support that thought or feeling that you have, some of them don't. So in this case, with the family, being in a car wreck, one piece of evidence that I have for it is taking longer than expected. So I write down, just taking longer than expected. Sorry, I'm messing with the focus here. I can only see a little bit in my little viewfinder, so you get the point. So taking longer than expected. That's one piece of evidence that, does lend itself to thinking that maybe something happened. Another piece of evidence there is that my wife isn't answering my texts. So in this case, I texted her and she didn't say anything back. I'm like, hey, you a lie? It's taken a while. Are you okay? Just give me some sign of life. And it's taken a while for her to text back. I haven't seen anything back from that. On the other side, evidence against it, one thing that I could write is that I know where she was going in town, and sometimes there's just a lot of traffic there and it takes a lot of time to get through the parking lots and things like that. So I could put lots of traffic in that area. So I put there, lots of traffic in that area. So again, I know that there's a lot of traffic that goes on in the parking lots and just the area surrounding where she was at, shopping or whatever. And so, it's reasonable to expect that that's probably the case today as well. Another piece of evidence that's against that is that she's working with 2 kids, and it's hard to get to the phone to text or write or answer anything that I sent to her. So I could write down having both kids makes it hard to answer me. So here I just put both kids and then an arrow, can't answer me. So both kids leads to her not being able to answer me. Another piece of evidence that might be against it is that if she is driving home, then she probably doesn't want to text so that she can keep herself safe, which is actually what I'm trying to make sure happens in the first place, right? So texting while driving equals bad, right? So texting while driving equals bad. You could go back and forth with this, right? So you can kind of play devil's advocate with yourself. So if that is a piece of evidence against it, I might say, well, she has hands-free things in her new car, so she could text me with that. So I can write that down. Hands-free texting means she can text me back while driving. So hands-free means that she can text me back. Okay. On the other side of that, if there's a kid screaming in the car, it's very hard to get the car to get, Siri on your phone to understand what you're trying to text. So screaming kids equal no Siri. Right? So screaming kids equal no Siri. So again, we're trying to get a balanced perspective here. Not trying to convince myself that she's okay, but I'm trying to see, okay, let's pull back, let's be objective, let's look at all of the different evidence here. And what you can do with this is you can sort of evaluate how you feel before you do this exercise. So you can say, okay, I feel anxious, I feel worried, I feel a little bit upset even. Because a lot of times what we do with anxiety or depression is instead of having a situation and reacting to that situation, we react to what we think is going to happen or what has happened, right? So let's see. So rather than the situation leading to our feelings, we have our expectation or our fantasies about it, not fantasies in like a happy way or, a pleasurable way or whatever, but our fantasies, what we think might happen, our expectations, our sort of stories that we tell ourselves, we react to that. So we kind of emotionally jump the gun instead of saying, okay, here's the situation at hand, let that dictate how I feel about it. We say, okay, this is what I think that means, so let me go ahead and jump the gun and emotionally react to that thing over there. Right? So often, in these cases, I'm already feeling upset a little bit because I'm like, okay, my family's dead. I got to figure out what to do now, right? Obviously a morbid thought, but sometimes you make that leap and you start already emotionally reacting to that fact that's not even true yet. So this is one way of sort of reeling yourself back. And so you kind of go through this exercise, and maybe at the end of this exercise, I write down all the evidence for, all the evidence against, and I say, okay, well, I don't feel great, but I feel maybe apprehensive, but I'm not like in despair. I'm not anxious. I'm just kind of worried. I'm kind of a little bit, just concerned about it. I'm not as stressed and over the top. So maybe I kind of came from here to here. And in a situation where, maybe you suffer from anxiety of whatever type, that could be very useful, because coming from here to here might mean the difference between you driving the boat, deciding what you're going to do with yourself, versus anxiety driving the boat and saying, no, you're not going to do that. You're going to have a panic attack now, or, you're going to freak out and do something that you regret, like calling the police or whatever. And, it basically giving you more control over the situation. So that's the 2-column technique. Again, what we're doing here is we're just breaking a piece of paper into 2 halves, evidence for and evidence against our assumption. Now, doing this is going to be tough at first, because you're so trained and so good at finding the stuff that's evidence for your negative assumption. So it's going to be a challenge to push yourself to really see the whole picture there. And for that reason, it could be helpful to enlist the help of other people, trusted loved ones, friends, family, a therapist that you might be working with, and have them maybe offer some ideas for the other side, and, until you kind of get the hang of it. But it is a practice. It's something you need to do over and over to help yourself really internalize that sense of, okay, I need to look at the whole situation, not just emotionally react to this made up thing way over there that hasn't even happened yet. So that's the technique. I usually just call it like a 2-column technique, but it could go by a million different names, I'm sure. But the idea is basically you have your hypothesis, you test that hypothesis rather than just jumping the gun and making a conclusion. So hopefully that was helpful to you. If you want me to do more sort of mini CBT type exercises like this with you, let me know. I got a bunch of them and I'd be happy to share them. Thanks.